My name is Robert Flisiak. I'm a head of the Department of Infectious Disease and Hepatology in Białystok, Poland. I want to express my thoughts about COVID-19. It was 3 years ago when we get message about this horrible disease which just started somewhere in China. It was just 3 years ago. And after these 3 years of our fight with these pandemics, we still have questions which are not solved. I'd like to present only my impressions, my questions. The first of all, the major question is if COVID-19 is going to return. If yes, when? In autumn this year or after several years? Or maybe it will be completely different coronavirus which arrive within, let's say, 8-10 years, as it was happened with SARS and MERS. The second question is if our immunization, which we achieve with infections and vaccination, how stable it will be. How long it will be sufficient to protect us against new infection. The third question I would like to ask is, do we have chance to get new vaccines, possible combo vaccines, which include not only anti-SARS-2 protection, but also flu and RSV, just to avoid the troubles which we in Europe usually have in autumn and winter with overload of respiratory infections. And the fourth question, which I would like to ask, is about medication. Should we expect new drugs, antiviral drugs? Probably yes, but how to test them, their efficacy, when we have such a large number of very mild disease, which is difficult to use as endpoint for the evaluation of efficacy of medication. So those questions I hope to have to be solved during the ECCMID in Copenhagen.